Normally now women or even men are becoming fathers or mothers in mid-30s. So this is where these two subjects are coming together, oncology and fertility.
The ovaries are a very radio-sensitive organ.
Around 15 to 20 gray is good enough a permanent ovarian failure in almost all the patients.
A huge health impact on the woman.
As well as the emotional.
Absolutely.
Welcome to today's episode. Cancer treatment is no longer just about curing diseases.
It's about preventing quality of life.
One aspect that often goes unnoticed is protecting ovarian function.
Who need pelvic radiation? Today we are going to discuss remarkable procedure called
Robotic Ovarian Transposition,
which can help preservation of hormonal health, even future fertility. Today we are joining with Dr. Arunava Roy, Gynaecologist Oncologist, Dr. Sayan, Radiation Oncologist, and Evelyn L. Ralte, our patient. Welcome to our show.
Thank you.
Dr. Arunava Roy, sir, I'd like to ask the first question to you.
why is hormonal fertility presentation is important in cancer treatment?
Well, that's a very valid question in today's era. So basically two things have happened. If you look into the WHO data, you see that the number of patients who are getting malignancy at a younger age, it means less than 40 years, is sharply rising.
Wow.
Whereas the age of bearing child or becoming a father or mother is rather increasing. One generation ago, like our fathers and mothers, they became fathers and mothers by 25, 26, but normally now women or even men are getting, becoming fathers or mothers in mid-30s. Late marriage, late childbearing. So this is where these two subjects are coming together, oncology and fertility. And that is why when we are, treating these patients who are having a malignancy or cancer in early age, most of them are presenting in early stage because of increased awareness, and they will do very good with cancer treatment in future. But we should take care to preserve not only their fertility but also hormonal functions, and give them a very good quality of life.
Absolutely. I'll come to Dr. Das. What happens ovaries when the uterus, when they receive pelvic radiation, and how it affects fertility in women's health?
Okay, so thank you. It's a very pertinent question. As Dr. Roy said, that what is important is not only when we are trying to preserve the ovaries, we're not only looking at maintaining fertility or taking care of fertility issues, but we have to preserve ovarian function as well, because the ovaries are a very radio-sensitive organ. By that, what I mean is a single radiotherapy fraction of around 2 gray is what we think the doses is capable of killing almost 50% of the immature oocytes, so the eggs in the ova.
Now just compare this with the total doses that we deliver for a pelvic radiotherapy is in the range of 45 to 50 gray. And for that, even a 2 gray can damage almost half of the eggs, and around 15 to 20 gray is good enough
to permanently cause ovarian failure in almost a majority of the young population.
So a 50 gray course of radiotherapy will eventually lead to a permanent ovarian failure in almost all the patients.
That is why we need to decide before we begin treatment. So this should be part of the initial discussion for a suitable candidate about how to preserve the ovaries. Because ovarian function preservation means because ovaries not only they produce the eggs, they produce important hormones, right? Estrogen and progesterone, which has several implications in maintaining the different organ functions, including metabolic functions as well. So when you lose ovarian function, what you end up with is a premature menopause. So you have bone issues, cardiovascular issues, neurological issues, several things other than fertility as well.
Thank you. So, just the way Dr. Das has elaborated us what the things we can face if someone get the pre-menopause. So, what are those things that preserve reproductive and emotional health in young women, if you can please?
So, as you mentioned, that a young woman receiving pelvic radiation for any malignancy, it does not need to be gynecological malignancies only. It can be a colorectal malignancy or a pelvic sarcoma cancer. Whatever disease, if a young woman is receiving radiation, we should consider, the ovarian, and in sometimes the patient who have not born child, we should consider uterine preservation also, because the radiation also destroys the inner layer of the uterus, which is very important to get future pregnancy. So in
Definitely.
women who are not suffering from uterine cancer but getting radiation, in them preservation of uterus is also important if they're desiring future fertility. Now, just imagine a woman of 35 years old who is receiving a radiation for pelvic malignancy, which has very good survival. She survives the disease, very good, but she becomes menopausal after the treatment.
Exactly.
So that brings a huge health impact on the woman.
As well as the emotional impact.
Absolutely. So it's not only the physical parameters that Dr. Dash mentioned. These hormones are also related to the mental parameters.
Definitely.
It can lead to mood swings, reduced sleep, insomnia, reduced libido, urge, everything of a woman is related to that. So to preserve ovaries, number one, what we do generally is do a small procedure, which is a microsurgery, where we take the ovaries, detach them from the connection to the uterus, and put it in the upper abdomen above the pelvis near the kidneys, so that when the radiation is being delivered to the uterus, the ovaries do not get receive
hampered.
any radiation, and they are not hampered in any way. Sometimes it has happened that women who had this procedure is called ovarian transposition. So it is not transplant, it is transposition, that you are positioning the uterus from the pelvis upstairs. So in that, what happens is, in some women who has received radiation, sometimes post-radiation they start menstruating because they have the hormones.
Exactly.
So those women should not become afraid that why I'm bleeding again. I had my radiation. It's a normal menstruation. Yet they are one of the most happy candidates. Okay, I received radiation for a pelvic tumor, but I'm still menstruating because my ovaries are preserved.
Ovaries are correct. Function.
Yes, this is for women who had already born children and not desirous of fertility. But if a woman is desirous of fertility, then her uterus also needs to be preserved. In that case, we do uterus transposition also, where the entire uterus and ovary is detached from the pelvis and brought into the upper abdomen. The patient receives radiation, and post-radiation it is put back where it was, and they can bear pregnancy and can become mothers.
Wonderful. I'd just like to ask some question to Evelyn. Hi. What was going through your mind when Dr. Roy discussed this treatment with you?
Honestly, like I was overwhelmed. Like all you could think is like how to survive. I'm thinking only about the treatment, not about my ovaries or fertility. And when Dr. Arunava Roy introduced me about the ovary reposition, like I was like very happy, and I want to thank him from the bottom of my heart.
Were you anxious at that moment of time when you
Yes,
heard
of
that you
course.
have to go from another surgery through another surgery? Were you anxious?
Kind of, but I trust in God and I trust my medical team, and so like I'm confident.
Thank you. I'd like to ask Dr. Das, can modern radiation technique completely spare the ovaries if they are in the pelvics?
So, in spite of several technological advancements in the field of radiotherapy, whether you use the most sophisticated form of radiotherapy, but still if the ovaries are within the pelvic cavity, it is not possible to spare them, because as I said, it is a very radiosensitive organ. So unless you position them away from the radiotherapy portals where we are going to treat, it is not possible to spare the ovaries. No.
Okay. So what are the specific cancer in young women where ovarian or uterus preservation should always be considered?
Definitely. So as Dr. Roy said, so the most common areas where you should be considering is the anorectal malignancies, so anal canal, rectal cancers, for pelvic sarcomas, which are unresectable pelvic sarcomas, and it's some cervical cancers where we can consider ovarian transposition. For uterine transposition, we have to consider these anorectal malignancies as pelvic sarcomas.
So again, I'd like to ask Dr. Roy, what exactly ovarian transposition is and why is robotic surgery suited for this procedure?
As you see, ovarian transposition is basically, in very simple terms, repositioning the ovaries outside the radiation field. So, if you are treating a malignancy in the pelvis, the radiation is most of the time, concentrated in the pelvis. Very rarely it goes upstairs. If it goes upstairs also, it's mainly in the midline, not laterally. So what we do is the ovaries normally hang from the uterus like light bulbs, okay, with wires which are connected to the uterus. So we detach those wires. So we detach the ovaries from the uterus, and with their blood connection and nerve connection intact, we mobilize them and put it upstairs, just below the lower pole of the kidneys. So that is not only above the pelvis but also away from the midline. So whatever kind of radiation they're delivering for the pelvic malignancy, those ovaries don't receive radiation.
Radiations.
You also mark them with, certain metallic pins,
Okay.
so that it is very easy for them to identify it when they're planning for radiation.
Okay.
And one thing is very important to understand here, that if a woman who has undergone only ovarian transposition desires fertility in future, it has always to be gained through assisted reproduction or test tube, because the normal position of the ovaries is away from the uterus. So a woman cannot become normally or naturally pregnant after this, but definitely they can become pregnant with their own eggs using IVF or test tube baby.
So how was your journey, if you can say that, how was your recovery after robotic ovarian transposition? Were you able to take the radiation after that only?
My robotic surgery on Friday, and the next day itself I was discharged. That was Saturday, and my radiation treatment was started on Monday as planned.
That was
Yes.
very speedy recovery,
Yes.
I must say.
Yeah.
And now also you must be feeling very okay.
Yes.
For this patient, this surgery is not the treatment of a malignancy.
Okay.
It's not the treatment of a cancer. That is being done by Dr. Das in radiation department.
Definitely.
So the procedure should be such that it gives minimal trauma, minimal blood loss with fastest recovery to the patient, so that the patient is not delayed for a main treatment. So if I do a surgery and then it takes 15 days for my patient to heal and then go for radiation, the patient has lost valuable 15 days before starting radiation.
Exactly.
That is where robotic comes in, and this gives a very, a very beautiful recovery to the patient, so that they are operated next day. They are planned by the radiation department for for radiation, and they can start the radiation within 48 hours. That is the main aim of doing robotic.
Time is precious.
Absolutely, absolutely.
So Dr. Roy has already said us that the fertility. Do you have a chat with a fertility specialist before this?
Absolutely, it has to be a very integrated teamwork. In the present scenario, what we have with Evelyn is, she was not desirous of fertility. She already has fertility. Yeah. So in patients where fertility is a concern, in Evelyn's case, we were preserving ovary and hormones. But in patients who want to preserve fertility, definitely it has to be, the team has to be extended, and a fertility specialist must be included. So some patients may want to preserve eggs before the treatment. Some patients, may need a counseling that after this procedure, you cannot become pregnant naturally. You have to undergo a IVF or test tube procedure to become pregnant in future. So it's very important to bring in the fertility specialist in those scenarios, because they do a lot of other array of tests to know whether we are trying to do and preserve fertility in a couple, but actually what is the fertility profile of that couple? Are they good? Are they having good fertility profile? So that is very important to be tested before you do a fertility preserving procedure. So this is where the arena where they come in, because definitely that patient is going to need the help of the fertility specialist in future.
Definitely, definitely. So, Dr. Das, how does this procedure help you to during radiation planning, and does it compromise any cancer treatment in any way?
Okay, so that's again a very common question, Raj, that is asked because they are very apprehensive that whether it's going to cause any detriment to the treatment outcomes. Well, to assure them, it does not, because that's where patient selection is the key. Important thing is the collaborative work between the departments. So in her case, she got operated on a Friday because it was a robotic surgery with a very fast recovery. On the very next day, we went ahead with the radiation planning thing, and from Monday onwards, we were able to start her treatment. So the procedure is seamless, or it can work in a seamless manner, provided everything is done in a very coordinated manner. So as Dr. Roy mentioned, that while doing the procedure, they would put some metal clips, which helps us to identify where the ovaries have been repositioned. Because what we do is, even during planning radiotherapy in the pelvis, we would still monitor or measure the doses received by the ovary, because there is some amount of scatter variation, but again it is minuscule. So as I said, the limits of the threshold is less than 2.5 grays. With a properly repositioned ovary, the doses would be less than
Negligible.
less than 20% or even that. So it's around 50 centimeters is what is often received. So yes, it can be done without without compromising on the survival outcomes for the treatment that she's being planned for.
Thank you, Evelyn. Thank you, Dr. Das. Thank you, Dr. Roy. Today's discussion reminds us that modern cancer care is about more than treating the disease. It's about protecting the future. Robotic ovarian transposition is a wonderful example of how innovation and teamwork can preserve hormonal health, maintain the possibility of future fertility
in appropriate patients, and allow life-saving radiation therapy to proceed without unnecessary delay.
If you are a young woman facing pelvic radiation, don't hesitate to ask your cancer team whether ovarian preservation is an option for you. Every patient deserves not only the best chance to cure, but also the best possible quality of life beyond cancer care.